Vanakkam, Namaste and welcome to Dr. Shahs Clinic. In this video, I am going to answer an important question. The question is, does varicocele surgery improve erectile dysfunction? Now, to answer this question, it becomes very important to, first answer another question. And the question is that, first of all, does varicocele actually lead to erectile dysfunction? And it's very, very sad and actually disgusting to see a lot of videos where a lot of qualified specialists are actually telling that varicocele in itself leads to erectile dysfunction, impotence. Varicocele affects the semen parameters. Varicocele causes low testosterone and male infertility problems in men. Whereas the scientific studies are largely very, very clear. There are numerous published papers which have clearly, told or which have clearly failed to establish an association between the clinical condition called varicocele as well as erectile dysfunction. In fact, there was a large-scale study which was done in the Journal of Sexual Medicine, which was published in the year 2012, which found a very small association between varicocele as well as erectile dysfunction. Now remember one thing, just because two clinical conditions are present in the same person or the same individual, it does not mean that one condition leads to the another. So normally when we work up a patient for male fertility, we tend to notice, when we do a physical examination, the patient may have a clinical history of erectile dysfunction, and on the physical examination we may notice a varicocele. But that does not mean that this particular varicocele, which is nothing but the accumulation of blood in the papilliform venous plexus in the testicle, right? That's how a varicocele looks like. When you palpate the testis, you have a bag of worms kind of feeling for the clinician. So that does not mean that when we work up a patient, patient comes to us with erectile dysfunction history and we see a varicocele, it does not mean that the varicocele actually led to the erectile dysfunction. And here's ample evidence to even counteract that, ample evidence to support that point, because a large number of healthy men, up to 25 to 30% of healthy men, will have undetected varicoceles, and that could be grade 1, grade 2, grade 3. It's just that they don't go to the doctor. There's no need for them to go because their fertility goals have been met. So if these men had, if 30% of men, that's a big number, that means 30 out of every 100 men is going to have some degree, some subtle varicocele or the other. All of them would also supposedly have erectile dysfunction. That's what we should have picked up clinically, but that never seems to happen. So how can varicocele, first of all, lead to erectile dysfunction? Plus, there's no scientific evidence to also support that. So why should you even do a varicocele surgery in order to improve erectile function? Sadly, today, a lot of patients are being misled. There are some doctors who are actually doing varicocele surgery, claiming that the varicocele is the reason for the erectile dysfunction, instead of properly treating the erectile dysfunction. There is absolutely no clinical connection between varicocele surgery as well as erectile dysfunction. Most of the time what happens is, when an unnecessary surgery is performed on the patient for a varicocele, things only tend to get worse. It doesn't improve. The erectile dysfunction continues to stay. There have been no studies, at least from my limited knowledge, that have explored the association between, systematically at least, the association between a varicocele surgery and the improvement of erectile function post the surgery. Although there are some studies which say that after varicocele surgery, the testosterone in the male goes up, then as a result, his erectile function goes up. The joke is, testosterone itself is very loosely correlated with an individual's erectile function. So a man can have subnormal testosterone or values of testosterone that are slightly below normal and still have a good erectile function. So leaving that for another day, all I can say to you here is, if you have a varicocele and if you also have erectile function, please ignore the varicocele. It doesn't matter at all, because most normal men will have it anyway. And should a doctor or a fertility specialist advise you to do a varicocele surgery for improving your erectile function, don't fall trap to that nonsense. That's utter bullshit. You do not need to do a varicocele surgery in order to improve your erectile function. So does varicocele surgery improve erectile function? The answer is a big bloody no. I hope you found this video informative. Please do comment, like and subscribe. Share this video with all your friends and loved ones. This is Dr. Shah. Vanakkam and Namaste.